So I want to thank you all for joining us today. We're happy to have this space to share with you and provide an overview of effective peer support in looking into how peer support is defined, the scope of practice, as well as highlighting the benefits of peer support services. Before we get started, we just have a couple of housekeeping items to review. Today's session will be recorded and the slides will be made available. I would also like to encourage you to utilize the chat box feature in your chat with any questions throughout the presentation. We will have all participants muted today. We are expecting a very large group, so we really do encourage you to raise your hand or to definitely utilize that chat box, and questions will be addressed as we go through the presentation. Today's agenda will follow as such. We'll do some welcome, some introductions, which I can see in our chat that we've already gotten a head start on, which is great. I see such a really diverse group of folks that are joining us today from across the state. We will move into what is peer support. We'll talk a little bit about the scope of practice, and then we'll have a nice introduction to our organizational self-assessment tool. We will highlight what peer support is not, as well as the benefits of peer support. Well, let's move into some of those introductions. I'm Amy Perley, and I'm happy to be here with you all. I am the co-director of PeerTech, as well as a New York State Credentialed Family Peer Advocate. I come to you with a diverse background of experience. My two daughters are into their adult phase of life, so I've had the opportunity to access and to advocate throughout the children's system. And now I'm starting to learn a little bit about that adult system. So I'm happy to be here. I'm happy to share this space. Rita, would you like to introduce yourself?
Hi, everyone. I'm Rita Cronice, and I have about 25 years, it's coming up on 25 years of experience with peer support. I became certified in the VA. That's where I got my certification. And I then have done a number of things like I was a former director of the International Association of Peer Supporters. I came to Rutgers, did the Academy of Peer Services. I've been very involved with that for 10 years and was just so delighted to be asked to co-direct the Peer Technical Assistance program. So I'll tell you a little more about some of the adult side of peer support. And with that, I'll hand it over to Jay.
Hey, good afternoon, everybody. My name is Jay Culkin. I use the pronouns he, him. So I'm the youth training coordinator at Families Together New York State right now. I'm a professionally credentialed youth peer advocate, and I hold a provisional peer certification specialist as well. So I have lived experience in the mental health system both as a youth and as an adult. And I have lived experience as well with receiving services meant to support autistic individuals. So I've worked as a youth peer advocate in the residential setting, the clinic setting, and the community setting so far. So it's good to be here. Thank you.
Thank you, Rita, and thank you, Jay. Now that we've introduced ourselves and you know a little about who we are, we would like the opportunity to learn a little bit more about who you are, right? I've seen everybody introduce their name, perhaps where their agency and where in the state they hail from, but we would like to know a little bit about your role within the organization. Do you hail as a CEO, an executive director, supervisor, peer specialist, family advocate, youth advocate? Please please utilize the chat, not the chat, I am so sorry. Please utilize the poll to be able to comment your answers so that we can see what representation we have with us today. Is everyone able to access that poll?
I know on my end, I see a lot of people filling it out. So
Okay.
I'm just giving a second for majority.
Okay, perfect. Thank you, Angelique.
Yeah, those of us that are presenters or co-hosts can't answer it. They won't let us.
I know. Okay, I think we're ready. Let me share what I have.
Oh, thank you. All right, so I see that we have a pretty well balanced mix of participants here. So we have some supervisors, very small percentage there. We have some supervisors that are not peers, high percentage of program directors or managers. And I see that we even have some organizational leaders or CEO here. So that's great to be able to reach that audience. And those of you who have not been able to make a selection, we see you in that chat as well. So thank you, everybody. It's really exciting to have a really good group because then, you know, we're able to have a really good discussion and know that we have a really strong reach. So thank you. So we're going to dive in a little bit. We're going to go right into what peer support is. All right. So what is it, right? What does it mean to you? We have a really big group here that I think would have a lot of different takes on peer support. So what I would like to see is what you think peer support is and what it means to you. And I would love for you to utilize that chat and to chat in some answers of what you think peer support is. Empowering of others. Partnership. Yes, Miriam, partnership, absolutely. Guidance, it's engaging. Providing support from someone that has been where they are. Yes, absolutely. Growth and development. Yes. Yep. And you're no longer alone. Correct, Rita. Absolutely. We are no longer alone in this. Person-centered. Absolutely. These are great. These are great. Sounds like you all have a good take on what peer support is. Let's define it, right? So a lot of you talked about, you know, not being alone. Well, we're not. Simply put, peer support is a natural human response. It's when folks they find commonalities, right? And they can be together and share similar circumstances and similar experiences. And it's that experience and that similarities that allow us to be able to support each other. So what are they? SAMHSA defines peer support as something that is encompasses a range of activities and interactions between people who share similar experience, just like we discussed, of being diagnosed with mental health conditions, substance use disorders, or both. The mutuality often is called peerness between peer support worker and the person or seeking recovery promotes connection and inspires hope. It's naturally occurring, right? So there's the difference between naturally occurring support and peer support services. The difference is when you're providing peer support as a billable service versus the responsibilities. Those responsibilities are job task documentation. And that is the difference between naturally occurring, which involves us to be able to make that linkage with our lived experience. Before we dive into what peer support services are, we have to understand the providers of peer support services, right? So who's provided, there's a youth provider, a family provider, and a provider of adults. Each is provided in a different way and is credentialed and certified in a different way. So adult providers are known as New York State Certified Peer Specialists. And family providers are Credentialed Family Peer Advocates, and the youth providers are Credentialed Youth Peer Advocates. Each provider is unique in that they each have lived experience. The lived experience is what sets the providers apart from each other's. And we're unique in the ways that we engage and provide that support. The experience provides the connection to those facing behavioral health challenges, and that understanding comes from personally facing our own challenges. There is reassurance in knowing you're not alone, just like we mentioned before. The term peer is directly related to that lived experience. In the mental health system, each peer's experience is defined a little bit differently. As you can see on the slide, an adult peer is a person who at some time in their life experienced mental health, addiction, trauma, or a related life disruptive challenges that may have included navigating the mental health system. They navigated that system on their own, right? So this is their own lived experience. Similar to the adult, a youth or young adult now between the ages of 18 and 30, whose personal experience required themselves navigating one or more child serving systems, such as mental health, special education, child welfare, substance use, juvenile justice, criminal justice, multiple systems. And then a family, their lived experience is on behalf of their child, right? So they don't necessarily access the systems themselves. They're there on behalf of their child. It's a parent, a biological foster adoptive, or a primary caregiver of a child with significant social, emotional, developmental, medical, and or substance or behavior use disability, which manifested itself prior to age 21. Family peer advocates provide those services within that children's system up to age 21. So a peer provider's scope of practice is defined by their role and their responsibilities. The New York State Certified Adult Specialist, Credentialed Family Advocate, and Credentialed Youth Advocate each have a specific scope of work that is unique to them. And it's important to note and be familiar with requirements of these peer providers. So a New York State peer specialist, I'm so sorry, I'm like getting a little dry here. So trained through the Academy of Peer Services and approved by the New York State Peer Specialist Certification Board. A Credentialed Family Peer Advocate and a Credentialed Youth Peer Advocate both received their training, which is developed by the Community Technical Assistance Center, CTAC, in collaboration with Families Together in New York State. So those are the differences. We have a certification and then we have a credentialing process. These credentials are required to bill for services within the mental health system in New York State. Within those distinct types of peer services that are available to support the individuals, youth, and families, we have to highlight that these are non-clinical supports designed to assist the individuals, youth, and families from that unique perspective of someone who shares a similar experience. A peer's experience of learning to grow and thrive while facing familiar challenges puts them in a position to share meaningful lessons that in a way is viewed as highly credible. The distinction among the services are highlighted here on this slide. So we have adult peer services, family peer support services, and youth peer support services. The difference here within each provider is that the adult peer services are able to provide pre-crisis and crisis support services. A difference that stands out for family peer support services is that they can provide for parent skill development. And youth peer support services are able to provide skill building and coaching. The referral for the services should be based on preferences and needs of the individual youth and family. Also, just to add, the individuals may receive more than one type of peer service support at any given time. What that means is that you may have a youth that's receiving youth peer support services alongside the family that is also receiving family peer support services. So they do share common service components among the peer type, but they do have those few distinct differences. So now I'm going to hand it over to Rita to take us through the adult peer support services.
Thanks so much, Amy. Yes, I'm going to talk a little bit about what some of the distinctive things of adult peer support services, and also mention that there are various definitions that come from various settings within New York State. A lot of the definitions we'll be using here are for the MOTRS clinics, the mental health outpatient treatment and rehabilitative services setting. That may be slightly different in different services. Crisis services may be different. Emergency services might be different. Inpatient services may be different. But we're going to use this OMH guidance as sort of the foundation for our definitions. And then if you're in a different system, be aware that some of these different definitions may be slightly different for your particular setting. So in the MOTRS clinics, the peer support services and adult serving programs are an array of formal and informal activities and supports provided to individuals who are experiencing social, emotional, medical, developmental, substance use, and or behavioral health challenges. And they're delivered in a way that's trauma informed. And I'll just mention very quickly that a lot of peer support values come from the trauma informed arena. So just I'll mention that peer support specialists are trained in trauma-informed practices. So that's a pretty natural thing for peer specialists in the adult world to gravitate towards. Also culturally linguistic, confident manner that recognizes diversity, equity, and inclusion. And that training is coming more and more prevalent as we go through the implementation or inclusion of peer support services in these settings. Certified peer specialists model recovery, may share their own recovery experience to support clients in the client's own recovery. So this came out of some guidance for the Mahoder clinics from OMH. And then in order to be able to provide services, as Amy mentioned just a moment ago, in the adult world, you need to be certified. So it can be a person who is fully certified or a person who is provisionally certified. Certification provisionally is going through the courses and then going through the process of becoming certified. And then an additional 2,000 hours of supervised work experiences is required to be fully certified as a peer specialist. So this is just information from the New York Certification Board. There's a scope of activities that we'll walk through in just a second. And this just really outlines the range of peer support services that can be used within New York State. So here's a little bit about the adult scope of activities. To be able to utilize unique recovery experiences to teach and model, encourage and empower, and establish and maintain that peer relationship. Provide the direct peer-to-peer interactions to assist peers with creating personalized recovery plans and meeting individualized recovery goals. So a lot of this is about the relationship, and a lot of it is about helping people to define what their recovery goals are and then helping them to make plans towards reaching them. More on the scope of practice is to maintain a working knowledge of the current trends and developments in the field of mental health, substance use, co-occurring, and peer services. This is one area where if you're an employer of peer services, just be aware that when peers in the adult world go through their certification process, they are checking the box that they will maintain a working knowledge of current trends and developments in the field. So the more you can help them to do that, to stay current, will help them to maintain their certification requirements. Serve as a recovery agent by providing and assisting people to obtain services that suit each person's recovery needs, assisting with empowerment and self-advocacy, working with people on problem solving, and working collaboratively with non-peer staff. And this is another really important aspect of being a certified peer specialist, because within your certification, you have committed to work collaboratively with non-peer staff to create programs and environments that are conducive to recovery. So this is all, according to the New York Certified Peer Specialist Board, application for certification. And when you check that box, these are all parts of the scope of activities that you're signing off on. Now, in addition to the scope of practice, there's also practice guidelines. So national practice guidelines were developed by the National Association of Peer Supporters back in 2013. I was very involved in that process. We came up with 12 core values of peer support that received 98% agreement from almost 1,000 people across the country who were doing peer support. And those values are that peer supporters are hopeful, open-minded, empathetic, respectful, agents of change, and honest and direct. And peer support itself as a practice is always voluntary, which means you support choice, mutual and reciprocal, equally shared power, strength-focused, transparent, and person-driven. So you can go to the National Association of Peer Supporters website. There's a link to that in the reference section of this guide. This presentation. And then just a little bit about the benefits of adult peer support. Back in 2017, SAMHSA, or the Substance Abuse Mental Health Services Administration, gathered together all the research that was available on peer support at that time, and they split off these infographs, is what they call information graphics, that summarized what the research was saying at the time. So some of the things that are benefits of adult peer support is increased social functioning, increased empowerment and hope, increased quality of life and satisfaction, decreased hospitalization, decreased self-stigma, increased community engagement, and increased engagement and activation to treatment. So those are some of the things that SAMHSA identified in the adult peer support world that are a benefit to the people that are receiving services. And we'll hear a little bit more about that towards the end of the presentation. And with that, I'm going to hand it back over to Jay.
Okay. Thank you so much, Rita. All right. So first we're going to define. Right, we're going to go through the definition of what youth peer support services are. So, youth peer support services are formal and informal services and supports provided to youth who are experiencing social, medical, emotional, developmental, substance use, and/or behavioral challenges in the home, school, placement, and/or community-centered services. Right. So, also to note that the providers of these services need to be between the ages of 18 and 30, so they have a certain proximity to the lived experience of the youth. So we're ensuring that they're involved in the process of their own treatment. We're providing them related skills. Youth peer advocates are making sure that they're meeting the youth where they're at, right? So as it says on the slide, that these services provide the training and support necessary to ensure engagement, like I'm saying, getting people involved in the treatment, active participation, and in the treatment planning process. Services are delivered in a trauma-informed, culturally and linguistically competent manner. So we're taught, youth peer advocates are taught in their training about cultural humility and being culturally humble, so that they can meet youth where they're at, no matter where they are. What does youth peer support include? So once a youth peer advocate is at least provisionally credentialed, their services become Medicaid billable. So at that point, the treatment plan should be created with the youth peer advocate um, together for those youth peer advocate services, and the youth should be involved in that treatment plan process. So I think that we could dive a lot deeper into more specific examples of the 5 areas when we have our collaboration hour next week. But I just kind of wanted to go through it real briefly with a few little examples. So skill building, maybe the youth wants to know how to get a bank account, how to journal, coping, mindfulness, art, etc. So that would be a youth peer advocate's role to help them with that. Coaching. So let's say the youth has an argument with a friend, and the youth peer advocate is asking some open-ended questions meant to help the youth consider different possibilities. So that's the coaching part of it. Engagement, bridging, and transition support. So, for example, a youth peer advocate accompanies a youth to a new school that fits their needs better, or helps the youth decide on a step-down plan when they're going from program to program. Self-advocacy, self-efficacy, and self-empowerment. Youth peer advocates sitting in on a treatment meeting just to ensure that a youth is heard. And then finally, community connections and natural supports. So let's say a youth peer advocate brings a youth to an art class at the library or attends an LGBTQ support group with them to kind of introduce them to those community connections. So the principles of youth peer support. The youth peer support should be youth guided. We should be partnering with young people, promoting independent recovery, providing mentoring, promoting advocacy, as I mentioned before, culturally curious, culturally humble, making connections. It's an individualized and strength-based type of service. So in summary here, the youth should be in the driver's seat as much as possible when it comes to youth peer support services. And the youth peer advocate is sort of like the front passenger in that car, if we're talking about driving, being in the driver's seat. And they're just noticing and being there to help with direction as needed. So youth peer advocates are using themselves to model and demonstrate that the youth is in charge of their own journey to recovery. There is hope, and they are powerful enough to get through things. So here are some of the do's and don'ts of youth peer support, just to give a little bit of role clarity. So provide services provide services and support directly to the youth, as opposed to providing services to the whole family. So youth peer advocates are interacting directly with youth. It's youth led, youth driven. Support the youth in establishing their own establishing and meeting their own goals, instead of deciding goals for the youth. So the youth is taking the driver's seat on deciding those goals, listening to the youth as opposed to diagnosing or treating the youth, as we'll get into, and we've gotten into previously. It's not a clinical service, so we're not diagnosing, we're not making those decisions for them. We're listening to them, we're hearing what they have to say and just observing. Advocating with the youth rather than speaking on the youth's behalf. So if there's a treatment team meeting, the youth is going to be encouraged to speak up for themselves rather than the youth peer advocate and the youth coming together, talking separately, and then the youth peer advocate saying, okay, I'm going to just talk for them. I'm just going to give the youth perspective. The youth is giving the youth perspective. Guiding the youth rather than forcing or pushing the youth to comply. So the youth peer advocate's role is not to tell the youth, you got to do this because they said so. It's more to provide the consequences, or explaining the consequences, providing information about the consequences, and then what do you want to do? Do you want to accept these consequences? Do you want to change, your approach to this, et cetera, et cetera? Teaching the youth self-efficacy, and empowerment skills, as opposed to using therapy-related approaches with the youth. Whether or not they're qualified. So a youth care advocate could, of course, be anybody. They could hold an MSW, but if their role is youth peer advocacy, then they are not providing those therapeutic approaches. They're not doing those interventions specifically. We are using the interventions from those categories, those 5 categories that we had on the previous slide, not CBT, DBT, and all that type of things. And then finally, we're connecting youth to natural supports and resources. We're not providing transportation, respite, et cetera. It's not direct care staff. Youth peer advocates they have a role, a specific role, that it's not a sort of administrative assistant type of role or anything like that. So getting into what the role of the youth peer advocate is, right? Building hope, sharing with purpose, destigmatizing certain human experiences. We're promoting inclusion, building relationships, providing individualized support, and empowering young people to take an active role in their healing journey. So as you might see, this remains consistent once again from the fact that youth peer advocates are using our lived experience to guide us through getting the youth to where they need to be in an appropriate way. So it's not meant to conflict with clinical services, but rather to enhance those clinical services as a whole. Okay. All right, so I think the graphic kind of speaks for itself here. The youth peer support is good for youth's health and wellness in many ways. It improves both the quality of services and the long-lasting outcome of the services. It's a path to the youth success, however they define that success. So as the graphic says, it includes increased self-esteem and confidence, increased social support and functioning, decreased substance use and depression, decreased psychotic symptoms, increased empathy and acceptance, increased sense of control over one's life, reduced hospitalization admission rates, increased sense of hope and inspiration, and increased engagement to self-care and wellness. Okay, I'm going to pass it back to Amy here for the peer support services for families.
Thank you, Jay. And thank you for highlighting youth peer support services. New York State defines family peer support services as an array of formal and informal services that supports families raising a child up to age 21 who is experiencing social, emotional, developmental, or behavioral challenges in their home, school placement, or community. What defines the family? A family can be a parent, can be a caregiver, can be an aunt, can be an uncle. It really, we don't define family. The family defines who they are. And that defines how the service is going to, flow and what those supports will be. These services are New York State Medicaid billable services. And what that means is that they do file that specific array of supports and billable activities. The services for family peer support are provided in a structured, strengths-based relationship between the family peer advocate and the parent and family member. This is on behalf of the child, it's for the benefit of the child and youth. So we are working with the families and the caregivers. We do a lot of advocacy, a lot of skill development, with parents, a lot of supporting individual homes, and really taking the plans of that youth into consideration within that home. The purpose of this service is to support the family, enhance their skills, right? It's to support the positive functioning within that household, within that family, for the benefit of the child, for the success of the child, to be able to, remain in a least restrictive environment, which is to remain in home. Next, please. On behalf of all of the family peer support advocates, right, we're here and we're able to build strength-based relationships with families and caregivers. Family peer support services provide that structured relationship between the FPA and the family. That personal lived experience of the FPA and specific training throughout that credentialing process supports the work that we do with families. We remain family driven and we're tailored to meet those family needs, and we do that within a trauma-informed approach. FPAs can help families learn and implement strategies that support their child's behavior. This could this could look into educational advocacy, which means we could go to an IEP meeting. We could support parents within IEP meetings to be able to advocate for the educational needs of their child. It could be coaching, it could be modeling. It could be, really working with families on how to navigate, a team meeting, right? So it's a lot about empowering the families to be able to be strength-based, to be able to be family-driven in what is best for their family. These services are community-based services. So these services are provided within your community and within your home, right? So, and they serve a multi-system. So they, what that means is that family peer advocates can serve as a bridge between providers. So there's a lot of collaboration, a lot of partnerships that are developed in assisting the families. What that doesn't mean is that we're not care managers, but we are providing that bridging support, and we are collaborating as part of that team. And we can support families in the capacity of doing that by, taking it back to that skill set, right? Taking it back to the modeling of, how to advocate for yourself. What is it that you need? And then family support really supports family members in discovering their strengths and remaining strength-based, right? We always at the end of the day want to be strength-based and family-driven. And in doing this, it promotes shared decision-making. This helps the family connect, right? And if we're strengths-based and we're educating the families on how to advocate for themselves, we're also supporting them and identifying what supports they do need, right? So family peer support services, we're not there to be with the family forever. I always say that this is something, and this is something I always say to my families when I used to work with them, is like, I'm not here forever. I'm here to not be here, right? I'm in this to not be in this. The idea is that, we're here to support you on your journey, lift you up, empower you so that you can advocate for yourself and that you are able to do your own plan and what's best for your family. In doing that, that bridging and that connecting piece is also connecting to community supports as well as identifying natural supports, right? Building that support system around you. We can do that in supporting, practicing strategies, working with other providers. A lot of times you will see, family peer advocates working closely and collaborating with youth peer advocates, because quite frequently you might have a youth that's receiving that youth peer advocacy support, and being able to work together so that we maintain an effective family-driven practice. Next. So, and given that oversight of the definition of family peer support and a little bit about the, service activities, what is the role of family peer advocates? Well, it is to share lived experience with a purpose. We have walked that journey. We are there. We're here to share it with a purpose. We're here to be helpful. We're here to be empowering with that family. We're here to support that family and to, support them in building some self-efficacy. Promote that advocacy, right? We want to advocate for our families just as much as we want our families to advocate for themselves. We are there to provide individual support. We are there to promote inclusion, and we are there to destigmatize human experiences. Part of, something that I've always taken away as a family peer advocate is that when you realize that you're not alone in this, that judgment goes away and there isn't a stigma there, right? There is no judgment. That we come in, we're there to support. We've been in your shoes, and there's something comforting about that. There's something that really empowers you to want to step up. And it's kind of an awesome experience to be a part of when you are working with a family, because it is truly empowering when they realize they're not alone and they're not being judged. Next. So that does take me a little bit into the benefits. I just naturally went into the benefits of family peer support services. Research suggests that, this form of support offers parents and caregivers that increased sense of self-advocacy, that increased empowerment to take action, and it does reduce that stigma. And it helps reduce that internalized blame. As parents, we often blame ourselves. So to be able to listen and to hear from somebody who has that shared lived experience, it helps you, heal in part of that journey, that you are not to blame, right? That you are here and that you're here to help your family. And family, we're here to help members reframe and, look at their experiences in a different way and to also help reduce isolation. And having that person in your corner that gets it, it's just so reassuring and it's empowering, and it really does promote hope, and it does promote, success. Next. Okay, so I'm going to pause just for a second because I'm like, whew, lots talking, but I appreciate everybody. As we move into our next section here, which is to introduce you to our Peer Tech organizational assessment. So we've been providing this overview of all of these peer support services that, really do reach across the lifespan. I hope we've increased your knowledge a little bit, and I hope we're giving you something to think about as we move into this assessment. Because we would like you to think about the organizations that you represent. Think about peer services within your organizations. How are they currently being implemented? How are they being rolled out? Are they successful? Are you having challenges? Right. So, and maybe some of you aren't even, in an organization that's providing peer services, and you're here to learn about how you can do that and what you can do to make a difference and start to make that peer inclusion attainable. So in doing that, we have this assessment tool, which is the organizational assessment. This is something that we can support you in measuring your knowledge, as well as your organization's knowledge. Next. So what is it, right? So I mentioned that it's a tool, right? It's an organizational assessment tool, and it's here to provide, organizational leadership and staff that are responsible for the daily operations within your setting. This could be clinic services. This could be, an organization that provides, family services. It could be something that provides youth service. It could be adult services. It could be, an organization or an agency that can provide lifespan services. And we want to think about those that are within those organizations, right? Our administration, the clinicians, our supervisors, human resources, our front desk, our support staff, anybody that is part of that organization. We want to think about how we can come together and to be able to look at things, and so that we can have successful peer inclusion, right? So this organizational self-assessment was adapted from a nationally recognized resource, and it provides some quality improvement indicators. It allows the organization to consider areas for modification that will lead to more effective teamwork through the inclusion of peer support services. So it's really a tool for you to look at and to take in and to reflect on what it is that your agency or organization may need areas to grow in, or really to be able to highlight things that you're doing very well. Next. So what today we're going to just focus on one of the domains, but I want to be able to provide some of the domains to you. There are 4 within this entire organizational assessment. We're focusing on the knowledge of peer practices because we are talking about peer services today. The other domains are organizational culture, hiring and onboarding, and supervision. And as you have registered for this webinar, you've also probably seen registrations for webinars to follow. Those are going to cover the organizational culture and the hiring and onboarding. And each of those webinars will have that component of the OSA within them as well for reflection. So the OSA consists of 25 statements, and it allows you to rate your current knowledge and application of peer support values and practices. It includes examining the organization's knowledge of peer services, the culture, the hiring practices. It takes all of that into consideration. It can be completed as a team as well as individually. There are 3 ratings: exemplary, adequate, and needs improvement. And as your response, as you go, we're going to take you to the next activity, which you will be able to participate and complete this as well. But as you're completing it and you're thinking about it, I really would like to encourage you to think about the overview that you were provided. Think about your organization. Think about where that organization sits right now with regards to inclusion of peer services. And think about how your work environment could be better suited for peer support specialists and peer advocates. So now I'm going to hand it over to Rita.
Thanks again, Amy. And before we jump to the next slide, actually, I will jump to the next slide, but before we start talking about this next slide, I'll just mention that part of the series that we're doing right now is an outgrowth from a 6-month learning collaborative that we did with organizations that were including peer support services in their array of services. And they had an opportunity to test out and kick the tires of this organizational self-assessment. And we got very positive feedback from that. So you're actually the first group that we're giving this to again, try it out, see if there's anything that we missed, or see if there's anything that you would like to see differently, because this was done, again, as I mentioned before, we were mostly focused on clinics, and now we want to make sure that what we're doing within PeerTAC applies more broadly to other settings as well. When we developed the organizational self-assessment, one of the things we paid close attention to was how organizations that were licensed through OMH responded to OMH inquiry about the qualities of service. They have something called standards of care, and we mirrored the organizational self-assessment against the OMH standards of care, and they break down how care is being provided against, it's care, but it needs some improvement, and here's what it might look like if it needs improvement. Adequate, if it's adequate, this is fine, it's okay. And then exemplary, this is above and beyond what's expected, and it's something that will further enhance the service that's provided. So that's why we picked the exemplary, adequate, and needs improvement ranges for when you look at a particular item on the OSA, like in this instance, knowledge of peer practices, our organization approaches the delivery of peer support as distinct from clinical practices, which helps to support the greater fidelity to the non-clinical peer support services. And then this just gives a range of the exemplary to the needs improvement. I'm going to go ahead, and I think the next slide is for us to take a chance to, there's a QR code that you can actually use your phone to access the online organizational self-assessment, or you can access it through the bit.ly code. So either way, what we'd really like you to do is to either access it on your computer or access it on your phone through the QR code. Bring it up, and I'll step you through the sections. You'll see on the very first page of the OSA. Trying to see on my phone. you'll see that it says organizational self-assessment, and across the top it says about the OSA. There's information about the OSA. You can kind of skip past that. There's something called getting started. You can sort of skip past that. And then you'll see when you get past there are sort of the indicators that say needs improvement 1, adequate 2, exemplary 3. Go to the next screen in the OSA and you'll hit something that says knowledge of peer support practices. So that's one of the 4 domains that we're having you fill out. There's only a couple of questions there. I think there's 6 questions under knowledge of peer support practice. So if you can get there, you'll see that number 1, the first competency is our organization recognizes that peer support specialists and advocates are uniquely qualified through their lived experience and expertise of recovery, either their own or by caring for a child in services. This expertise demonstrates resilience and ability to inspire hope, healing, growth, independence, and self-sufficiency. And then below that, that's the item you're answering to. Below that, you want to answer the question of what does my organization look like right now? If it needs improvement, then the peer specialists and advocates are not viewed as colleagues yet. Their role is less valued than other service providers. Adequate is that they are viewed as colleagues with a different specialty than other service providers. And exemplary is that peer specialists and advocates are respected for their expertise and viewed as an essential part of the service delivery team. So hopefully you've all been able to follow along and can see in the OSA, either on your phone or online, what I just stepped you through. And you'll be able to answer the 6 questions based on the needs improvement, adequate, or exemplary indicators that are in the OSA. We'd like to give you about 5 minutes to answer these questions, and then we're going to come back and ask you to tell us what scores you had. So you don't have to necessarily identify yourself, but we'll have a poll. So you won't identify yourself. You can just put in what score you got. It won't identify who you are. And it'll give us a sense of where those who are here, the 65 of you that are here, Amy, you won, the 65 of you that are here, where you're at within your organization right now in the ability to include peer services in your organization. So give us 5 minutes to do that, and then we'll come back with that poll. If you're running into any challenges, feel free to chat and I'll try to direct you. I know, actually, Angelique is going to take, do her first, and then I'll answer any questions other questions that come up. Okay, I think we'll take another 30 seconds or so to wrap this up and then we'll start to move ahead. Okay, so I'll start to debrief a little bit of what you just filled out. If you didn't have a chance to finish, that's okay. We're hoping that you will come back to visit us again next week because we'll dive a little bit deeper into some of what this means. And what we'd really love to have you do is take this self-assessment to the rest of your colleagues in your organization. That's really how we worked with this during the Learning Collaborative. So different people might have had different perspectives on where the organization was at, and that's one of the beauties of this kind of self-assessment. It's all internal to your own process of working together as a team, and it helps you to identify areas where you might be able to, well, first of all, congratulate yourself for the areas where you're strong, and then to look at areas where you might want to make improvements. So when I went through and filled out my self-assessment, I wanted to get a low score just so I could really take a look at that. So each section in the OSA, we have 4 sections in the OSA, has a range of possible scores because there's a different number of questions in each one of those sections. In this section, we had 6 questions. So if you chose all ones for the 6 questions, then the low score would be 6. If you chose all 3s for the section, it would be an 18. So my score for this was 7 out of 18, which is not great. So a score between 6 and 9 means that additional training might be required to understand more about what's beneficial in peer support practice and how to bring it into the organization. And PeerTech has a lot of resources to help if you're really struggling with how to do this or not quite sure whether you're doing it well. A score between 10 and 13 indicates that some basic knowledge is certainly there, but there's room for improvement and more room to practice. So again, consider how PeerTech might help your organization to move from adequate to exemplary. And then a score between 14 and 18 indicates that you have lots of knowledge about peer support. It's an area of strength for your organization, and you can help the peer that can help the peer support specialists and advocates to feel understood and respected. What we'd love to have you do if you're scoring highly on this OSA is to consider sharing what you're doing with PeerTech so that you can become an example for others to follow. So that's our kind of mini tutorial on the OSA. It's a brand new tool that we're releasing to everybody at this point in time. We hope that you'll be able to use it. And what we're going to do now is transition to a new section where one of the areas that's really sticky for most organizations is peer drift and lack of clarity in the peer role. So Jay's going to take us into another part of the discussion about what peer support is not. Go ahead, Jay.
I'm sorry to interrupt. Did you still want me to share the poll so people could see their
Oh,
scores or no?
yes. Go ahead and launch the poll. Sorry, Angelique. Yeah, go ahead.
That's okay.
I meant to have us launch the poll before we did this, but if you had come to a score, go ahead and enter it in the poll. We'll take a minute to get your scores and then we can sort of see where we're at as a group.
Sounds good.
Okay, I think we probably have gotten the ones that we've gotten, so let's take a look at what we've got.
Okay. And- Okay.
Oh, cool. Well, it's good to see that there's a large percentage that are right scoring with the adequate, which is where, most organizations should be, especially if you're fairly new to the process. 14 to 18, you guys have got to talk to me. So we have good examples to follow. And those of you that are between 6 and 9, often what happens if you're brand new to this and you won't score highly on the OSA just because you're just learning, it's a long process, and Amy's going to talk a little bit more about that later, but just know that this tool can be used to help educate areas where you can get stronger and do a really good job, to move to adequate and then to move to exemplary. So we really appreciate your time and your willingness to do that. Thank you. And I'll pass it to Jay.
Okay, thanks so much. Hi, y'all again. So I am going to go through a little bit about what peer support is not. But before I continue, if y'all could put in the chat just a few examples of what you think peer support is not. Different roles at your agency or agencies you've worked at that would not fall under the category of I see already, case management. Yes. Yeah, so not a case manager, not a therapist. Okay, not a person's buddy. Yep. So it's not a friend type relationship. Okay. Straight transportation. Yeah, we're not counselors. I see medication management. I see a dumping ground for things other people don't want to do. I appreciate that response because it does shed a little bit of light into that lack of role clarity that we sometimes have in these agencies. Trauma dumping. Yeah, so there are specific sort of ethical guidelines and strategic sharing and boundaries that we hold, so that's a good point. Sponsors, mouthpieces, not set to make people do things they do not want to do. Okay, those are some really great responses. Thank you. And a lot of them will pop up in the coming slides and discussions. So thank you for all your participation. Okay. Yeah, so the biggest issue with the role clarity can be the difference between peer support and the clinical approaches, right? So peer support uses language of ordinary human experience. Sometimes it can include things like code switching or using more layman's terms. More languages kind of meeting somebody where they're at using their language to describe their experiences and to describe our own experiences as peers, as opposed to medical language describing symptoms or diagnoses. So peer support focuses on recovery and resiliency, whereas clinical may be a little bit more curing or treating a certain ailment or illness or symptoms, services based on medical necessity. So peer support includes a person's strengths, whereas clinical focuses on symptom management and compliance. And, that's not to say that all clinicians are only focused on those things, but just the major focus when we're thinking about the goals in a clinical approach, isn't as based on that. This is what I want, and is a little more, I'm treating this particular symptom, and here's how me and the client are going to address that. Right. So in peer support, the person is considered the expert on themselves, whereas the clinical perspective, there's an emphasis on just solving the problem. I think that everybody on the team obviously has their own areas of expertise, but at the end of the day, peer support, the person's the expert of themselves. And then peer support includes person-driven services. It supports the person's choices and encourages shared decision-making, whereas the clinical approach relies on the provider's expertise for the best treatment and services. Again, while including the individual who's receiving services, which is a different type of perspective. So in summary, there are some big differences between the ways that peers use their experience navigating a system as their expertise, like a roadmap, rather than the way that clinicians use their education or work experience to have a formal medical lens to support the youth or the individuals receiving services. So it's worth noting that, like I had said previously, clinicians can have lived experience, or a peer worker or a peer support specialist, peer advocate might have clinical background of some sort, but it's all about what roles what roles different members of the team have, and not letting those roles crisscross based on that, individual who is receiving the services. So unfortunately, in my experience, as a youth peer advocate, and speaking to other youth peer advocates about this, there is a lack of role comp clarity. That is pretty common. And it's typically a lack of understanding by the agencies, rather than reflecting some sort of intention. So it's especially difficult when there's things like special circumstances, gray areas, instances that are like case by case that don't necessarily interfere with the ethical standards. And the same can obviously be said for FPAs and adult peer specialists. But in general, the role of the youth peer advocate is not to tell the young person what to do. It's not to be the spokesperson for the youth. We heard a lot of this in the chat earlier. It's not to be the young person's only resource. So that's a big one. Sometimes people will designate a youth peer advocate as a crisis point. That's not part of the youth peer advocate's role. And I'm specifically speaking about the youth peer advocates. I know that adult peer specialists that can be. Another part of what youth peer advocates are not, being a chauffeur for the youth. I know somebody had said transportation earlier. That's not within the scope. Being the youth's babysitter, being a friend to the young person, and policing that youth. Okay. And then I will move on to the role of the family peer advocate. So the role of the family peer advocate is not to tell the parents or caregivers what to do. It's not to be the parent or caregiver's friend. It's not to be the parent or caregiver's chauffeur, right? That's just in general not a peer specific role. It is not to be the therapist to the parent or caregivers. It's not to be the spokesperson for the parent or caregivers, and not be the only resource for the parent or caregivers. Mirroring the youth peer advocate, not being a crisis provider and not being that always go-to person. It is the same with family peer advocates. Okay. And finally, the role of the adult peer specialist is not to be an expert or an authority figure, act as a junior clinician, a gopher, or an errand person, using clinical or diagnostic language, trying to fix what's wrong with the person, doing tasks for the person, taking away choices from that person, speaking for the person, telling the person how to recover, um, maintaining professional distance, being used as cheap labor or the solution to the workforce crisis, and not to work alone, right? Working in teams. Right? Okay. So I believe I am passing this back to Amy.
Thanks, Jay. So thank you for pointing out everything that peer services are not, right? Because, sometimes that, those lines get a little bit blurry. And sometimes peers are, asked to do things that really aren't within the fidelity of their services. So, just to recap a little bit about where we are at this point, we had that overview of, each of the different peer support services and each of the peer components and scope of practice that really does cross that lifespan. We also were able to touch in and do a little self-reflection using that OSA tool, and reflecting on where our organizations fall within, the inclusion of peer services, right? And, thank you for submitting all of your results. It was great to see, that we have a lot of folks in this room that are successful, right? Like, I do see success in those numbers and I do see growth. So I'm really happy about that. And in doing that, when we're thinking about our organization and where we stand in that knowledge of peer services and how we're being inclusive, I think that when you approach it, right, when you reflect on that, you have to ask yourself, well, why? Why do we want to be inclusive of peer services? Well, we want to be inclusive because there's benefits to peer services, right? We're thinking about how peers can strengthen an organization, and how when peer support is done to fidelity of its values, how great it is, and and what it can look like. Next, please. So we've talked about, adult providers, family providers, youth providers. We talked about the array of services. There's some differences, and then there's also some similarities, right, across that lifespan. Some of the benefits that each of the disciplines have in common across all types is when peer support leads and it increases, that sense of purpose and hope. We can't take away from that, right? We all are in agreement that, each provider in each scope of practice definitely provides that sense of purpose and of hope. Across the board, with those that we support, there's an increase in self-esteem. There's an increase in confidence, right? We are, strength-based, right? And when we're doing that, we're uplifting. We support the empowerment to take action, right? We're supporting those adults, the family members, the caregivers, as well as the youth, to really, empower themselves to take action, to really be family driven, to be person-centered in youth-centered in, the pathway to their recovery. We also, really peer support leads to empathy, leads to that acceptance, right? We're not alone in this. And we support that social support, that functioning. And within doing that, there's that recognition of engagement in self-care and wellness. All of these to me represent growth. All of these represent growth and possibilities for, success, for, individual success, for family success. Next, please. So a little bit, so we touched on, what it is that we all universally have in common as peers, right? But, there's also a little bit of, we can break that out a little bit, right? And we can look at the differences and look at it at side by side to what each level of support looks like. So as you can see on the slide, adult peer support inspires that hope. That hope is there. It's in every component. And adults provide self-help, and, we are providing support in helping those identify their goals. Family peer support offers that emotional connection, that informational and that educational support. Remember back in the beginning when I talked about the differences and the uniqueness of those services. Family peer support can provide educational advocacy. So, that is a piece that definitely is unique to family peer support. And youth peer support, it really truly is authentic youth engagement, right? You have a youth supporting a youth. It's youth driven. It's rooted in youth. It's rooted in the youth voice movement. And, in doing that, there's that connection piece, that collaboration piece. Next. So a little bit more for side by side is, just to be able to look at just a little bit more examples, with improved relationships amongst treatment providers. Part of what we do across the lifespan is, collaboration, the opportunity to be able to collaborate with other providers, as well as empower the individual that we are supporting or the family that we're supporting to collaborate as well. And in doing that, we are remaining person-centered, family-driven, and youth-driven. A lot of the other benefits that, really is highlighted from peer support services is, decreased stigma, right? The decreased internalized blame, decreased isolation, right? We all feel isolation. If you're an adult, you know, in your own journey, I'm sure at times there's been isolation. And when you have somebody that walks alongside you, it decreases that. It really provides strength. And, you know, it provides, you know, a little bit more sense of control over one's life. So a little bit more about, you know, benefits is that in identifying the strengths and needs, you know, we are bridges for success, and we are supporting, you know, the roadmap. I'm going to take a word from Jay because I just love that you use that word, right? We're supporting roadmaps for individuals and for families to continue on their own personal success. So I really like that. Next. So we know some benefits, right? We've talked about benefits. We've talked about why, or, you know, and what it isn't, what it is. So let's, you know, really highlight why, right? Why family peer support. I mean, as a parent, I can tell you why, because it's just really provided me that intimate level of support that I did not know I could ever have gotten, right? It's different that somebody would be able to be with, walk alongside you. And even family members, a lot of family members didn't understand, you know, what I was experiencing as a parent, accessing, you know, different systems and different supports on behalf of both my daughters. And, you know, in doing that, it supports the caregivers, it supports those strengths, it supports that success, you know, and it really, at the end of the day, really reduces and removes the stigma and feelings of isolation. And that alone provides strength, and that alone can provide just a foundation of why family peer support. So I'm going to pass it over to Jay to really drive home why youth peer support.
Thank you. So, oh, oops. Sorry about that. So why youth peer support? So it leads to increased number of youth members, participants within the programs and organizations, development of social network support network, social connection, community engagement, opportunity for the youth to truly understand, relate, and connect with older youth who went through similar experiences, and helps to remove the stigma and the feelings of isolation. You know, on a level of, you know, what I have done in my work so far with youth, I work with a transgender youth, and you know, I have the experience of being transgender, and I have noticed, you know, a lot of changes in just him wanting to be involved now, you know, in community, seeing that I was able to get through the things that I went through, being able to see, you know, a positive future for himself that he's not really able to see in a lot of other spaces, because a lot of times, you know, trans youth end up being very isolated, just like youth in general in the mental health system, regardless of their identity, or in the criminal justice system, foster care system, etc. You get so isolated because you don't see a lot of representation. So again, the youth peer support just really puts together, I can get through this, I can make it. So I would just strongly recommend, you know, youth peer services to anybody. Let me pass it to Rita then real quick.
Thanks so much, Jay. And I just wanted to wrap up the adult peer support before handing it back over to Amy to wrap us up. So again, why adult peer support? Because it inspires hope that recovery is possible and a person is not alone in their journey. It's active listening with a real world of understanding. People can active listen and not know exactly where somebody's been at, but we as peer supporters certainly do have some understanding of that. Advocating for and with each person, helping people find their unique voice, breaking through that isolation and loneliness, and connecting people to their community. And I think that's one of the most important roles, is to help people get out of isolation and back into a community where so much more healing can happen. And with that, I'll hand it back to Amy.
Thanks, Rita. And I want to be able to just, you know, really appreciate everybody for sharing today and asking some really amazing questions. And, you know, just to really drive it home, peer services, the work of all of peer services, right? The work of all of our providers, our certified peer specialists, our credentialed family peer advocates, and our credentialed youth peer advocates. It's not an adjunct service. It's a necessary complement to the work done by those on a team, right? By those therapists, by those case managers, and by other members that support any individual that's on their journey. And, you know, when peer services are added as a primary service to any treatment plan, specialists and advocates play a significant role in improving the health and the wellness because that unique ability to build trust from one-to-one relationship. You know, that trust that is really defined and has that linkage because of that lived experience. That's what makes us unique. You know, that really does in itself foster hope for others. And, you know, by utilizing the lived experience, you know, we really do emphasize, you know, the expertise of resilience and recovery in the work that we do. It's embedded in what we do. We want to be able to continue to empower and continue to lift up. But in doing that, right, we do all of those wonderful things, and you know, we're here to support. We're here to be, you know, to stay to the fidelity of our service to maintain success. We have to remember that it does not happen overnight, right? So, next slide, please. So it doesn't happen overnight, you know, and I like this. I like this slide because it does take time. It's a marathon, not a sprint, right? A lot of times people receive some support systems and they're like, all right, you know, you come in and you can help me fix this. That's not how it works, right? We're here to support. We're here to really, provide pathways for success, for empowerment. And you will encounter challenges. As a peer, you're going to encounter challenges to solve, any kind of needs that any family or youth have. But, you know, along those lines, you also have to remember to celebrate your accomplishments. And, you know, to do that, you have to remain strength-based, right? And that is embedded in the peer values that we have. We are person-centered. We are strength-based. We are driven. We're family and youth driven. We are here to be able to continue the good work that we do, to be able to complement services, to be able to be able to stay in this, right? To be able to continue to provide and stay on that journey, because in doing that, we are providing that hope. So as you think about, you know, those benefits, right? And you're thinking about the benefits of peer support, take it back to, the organizational self-assessment, right? I really look at that tool as an opportunity for your organization to look and to say, okay, and right, this is where we fall. This is our temperature right now as to, you know, where we are with providing inclusive peer services. To be able to reflect on that and then to say, but here are the benefits. This is why we want to continue to have peer services, to be able to be inclusive of that, and to be able to support families and youth and adults of, you know, along their journey, right? The benefits drive it home. And I encourage you to, you know, go back to that organizational assessment, take it back to your organizations. Really say, here, let's take a look at this. Let's do a self-check here, right? Let's see where we fall, and let's see how we can do better. What areas can we improve on? What areas can we take what we're strong in and make them even stronger? I just want to drive that home, and really thank you all today for your continued participation. And now we are going to move on to some questions. Let me just see what time we have. So we are at 2:22. So I'm really impressed that we are under the wire with regards to time. I saw a lot of wonderful questions in that chat. If folks want to chat in any additional questions, feel free. And if you are, you know, you're not really sure what questions you have, you want to think about it a little bit more, you want to revisit the slides, I encourage you to think about, you know, questions or, comments or any kind of concerns that you have with regards to, you know, any kind of the challenges implementing peer services. And if you're doing it and you are having success, I welcome you to think about that as well. And I would welcome you to bring that into a shared learning experience, a shared learning space that we are offering. next week we are offering a shared learning hour, right? Because I look at, peers, we're all peers in this room, regardless of what that role is. At the end of the day, we are peers to each other. And in doing that, there is space for us to learn from each other. So in that shared learning hour, I encourage you to come. I encourage you to bring your successes, bring some challenges, bring your questions, and let's learn from each other. That shared learning hour will be invited. You will be invited via a link that you will all receive at the end of this webinar. I do encourage you to register for that. We look forward to seeing you there. And in doing that, I'm going to highlight the next slide, which is the date for that shared collaboration hour, which is the 5th from 1 to 2. It will be an hour. And then to highlight some of the other offerings within our series, our next webinar will be on organizational culture to advance peer support services. That's on November 13th. That will also have a collaboration hour to support that. And then our third one will be in December, which will highlight recruitment, hiring, and onboarding. Now, each of these webinars will also feature the domain of that OSA that pertains to that topic area. So it'll be another opportunity for you to be able to take a really direct look into that domain and how, where you fall on that as an organization, to be able to identify your strengths and to be able to identify some areas that you would be able to acknowledge for some additional support. So we thank you all for being here. Truly, this was exciting to be a part of. We encourage you to not hesitate to reach out with any questions. We have our website, which absolutely highlights a lot of resources that touches across multiple different topic areas. We do have a great resource library. You can reach us at info@peertech.org. Anyone can reach out to that and ask any kind of questions, and we will be sure to get back to you and connect you with somebody that can really address any of those concerns that you have. We also encourage you to join our listserv. And in joining the listserv, you'll have access to a lot of different resources as they are launched. You'll also have access to our newsletter, which highlights many of the resources and many of the upcoming events. And that organizational self-assessment, this QR code will be able to take you right to that full assessment. So you can certainly share that out, right? Share it out with your peers, share that out with your colleagues, share that out with your leadership. And I encourage you to take it. I encourage you to have others take it as a team, and see, where you fall, right? And think about how you can bring that into that shared learning space. Just want to highlight a few of our partners. We always like to highlight those. Our partners definitely are supporting contributors into the work that we do, into the content that we develop, and our resources. As the slides are sent out to you, you will have access to the resources for the information that was shared today. So there are a few slides with resources on it. And then I thank you. I do have about 3 minutes. If there's any questions that anyone would like to ask in this space today. If not, I encourage you to register and bring them to our shared learning space.
I know earlier in our presentation, somebody asked to clarify the ages between youth, family, and adult peer advocates.
Oh, okay, yes. So I did see that, and youth peer advocates provide the age range for youth peer advocates to be able to provide that service is age 18 to 30. A family peer advocate is a caregiver, is a caregiver and a family member. It's a parent. And I quite honestly don't know if there is an age limit on that. I have never been asked that question, and I certainly will find that answer. And Rita, are there any, specific age requirements for adult peer specialists?
Yeah, 18 is the starting point for adult.
Okay, all right, so 18. One last thing I do want to be able to mention is our survey. When you get the link to be able to sign up for the collaboration hour, there will also be a link for a feedback survey for today's webinar. And I welcome your feedback. That, I take that feedback and reflect on that as well. So I appreciate all of the information. Thank you, everybody, for joining us today.
Thank you, Amy. Great job.
Thanks, Rita. Thanks, Jay.